What's up, everyone? We're going to show you 4 tips to treat your glute tendinopathy. The first thing we're going to do is we're going to show you how to stretch the outside of the glute. Most commonly, the glute med tendon is the one that's involved with a tendinopathy or tendonitis. It's felt on the outside of the hip. And you may notice this is just tender to touch. Also, you may have difficulty or pain with bringing your leg out to the side in a movement called abduction or during rotation. This is most commonly confused with trochanteric bursitis that a lot of patients develop. However, based on research, most of the time it really is more of a glute tendinopathy case. So the first thing is the stretch. So we're going to say this is Kinsley's right side that's affected. She's just going to lie on her back here, bring her leg across, her hip is flexed to 90, her knee is flexed to 90, and then she's just going to apply a little downward pressure here just to increase that stretch that she feels on the outside of the hip. And she would hold this somewhere between 15 to maybe 30 seconds, repeat this several times, and then just do this throughout the day as she can. The next thing we're going to do is a little bit of soft tissue release. So we have the Rolga 3-in-1 activator ball that we're going to be using. And so it's different sides on this, different contour areas. And so she's going to use this right here on this area that's most sensitive, and then she's just going to lie down and just relax and breathe through it. Again, with the 3-in-1, there are different areas that surfaces with different textures as far as like what would be more aggressive or more gentle as far as a compression. And so she can change this up, move this around, lie on that area, just kind of relax, breathe through it to try to desensitize some of that tissue and pain, and then modulate or decrease her muscle tone. And the first exercise we're going to do is a bridge with combined hip external rotation. So Kinsley's just going up into a bridge here while she's externally rotating her hips. She's using one of the bands from the Alpha Grips company. I like these bands, although you can use any band really that you want, but I do like the Alpha Grips bands. You can get those in a small set and they're really nice. And so she's going to do that somewhere between 2 to 3 sets, 10 to 15 repetitions, and she would complete this a few times a day. The last exercise that she's going to do is going to be a sideline clam, again using the band. We have a band by Alpha Grips, and so you can use any band like I said before, and she's just going to do this nice, slow, and controlled. She has her hip bent to about 60 degrees, her knees bent to 90. Do you have to have exactly 60 and 90? No, just whatever's comfortable. And she's just going to bring her legs out here and apply resistance or against the resistance of the band. How far does she go? She's going to go as far as she can comfortably. If she can't bring her knee all the way up, that's fine. She's just going to go a little bit, hold that a few seconds, and go back down. She would complete 2 to 3 sets of 10 to 15 repetitions of this and perform this a few times a day. Thanks so much for watching, guys. We hope this video helps reduce your pain and symptoms that you're having with your gluteal tendinopathy. Thanks so much.